This morning on BRN, human therapists surpass ChatGPT in delivering cognitive behavioral therapy. Joining me now to discuss this and a lot more is Esha Aneja. She is a medical student at UC Berkeley and also a spokesperson for the American Psychiatric Association. Esha, so great to see you. Thanks for joining us on the program this morning.
Yes, happy to be here.
I'm very excited to talk about this. And as we were talking about in the quasi virtual green room, AI is all the rage these days. And I think everybody, I mean, you have to be living under a rock to know about Chat GPT. And it seems like based on the work that you're doing in the therapy world, Chat GPT is being, and AI are being utilized.
Yes, definitely. We're seeing it more in the space of psychiatry and in healthcare in general. So it's pretty interesting.
And how does it, I mean, my knowledge of AI is pretty basic. I only can tell you what I read. I've interacted with AI in terms of like chatbots, but how is it being applied, or is it being applied in the world of therapy and psychiatry?
So as we know, more and more patients sometimes, before they go see a provider are asking their healthcare questions on some of these chat bots like ChatGPT. So we definitely in healthcare, as providers, are seeing more interest in ChatGPT being used or AI being used, and patients are commonly consulting these sources sometimes even before they're seeing providers or to even supplement their care. And then this has some implications because some people might not even make it to provider appointment, or with the growing healthcare needs and mental health needs and the shortage of mental health providers, it is a resource that's being more utilized by patients.
And to that end, I mean, it would seem to me the human therapist brings a lot to the table that I don't think, just in my own knowledge of AI, is on the same level as a human therapist. I mean, it's right. Am I wrong about that? I mean, they might be going to a chat GPT or a AI bot, chat bot to answer questions, but it's not at the same level of a therapy I get from a human.
Yeah, that's a great question. That's what the research I was doing was looking at, because we were really curious about that. And yeah, generally speaking, most people think that a human therapist would generally do better than an AI therapist. So that's why we conducted our study to see in what domains or what areas is it performing better, and in what areas is it performing similar. So there's also another side to that with some people who might be shy to go see a provider, or maybe the appointment wait is several months. So, is some care better than no care through these chatbots? So, these were all the questions we were kind of looking at.
And what did you find? I mean, what was the net result of the study? I mean, obviously we can go read the study, but in terms of maybe some key takeaways, I mean, there are probably some good things it does and maybe things that it needs to improve upon, meaning the AI.
Exactly. So our study looked at ChatGPT 3.5, which at that time was the most updated version. Now it keeps updating, so there's more updated versions, and the chatbot keeps improving. But with our study, we were looking at a human therapist and then the ChatGPT 3.5 being the AI therapist. We had a third-party patient that was role playing both, and then we had participants who were blinded to the transcripts, so they didn't know one was AI and one was a human therapist. They didn't really
Mm.
know on the purpose of the study, so they weren't biased. And we were judging the results on the cognitive therapy rating scale, which is commonly used in psychiatry for giving evidence-based cognitive behavioral therapy, which can treat things like depression, anxiety, PTSD, so broad range of treatments. And our study found that the human therapist outperformed the AI therapist actually across all of the domains that we measured. The most notable being with empathy, people said that the AI therapist offered more superficial responses. So, although it had similar professionalism and similar superficial understanding, it wasn't always able to deliver the personalized care that participants wanted.
Yeah, I was going to ask you about that. The empathy, the relatability. I mean, this is why not only in psychiatry, but with any doctor or any service provider, I think a lot of people like that one-on-one, being able to not only look at the person, but have them kind of empathize with your situation. It makes it more relatable, and probably, I'm not a professional psychiatrist, but probably helps implement the treatment plans better overall.
Exactly, yeah. And some of the participants, for example, were reading the transcript and saw that, for example, there was something about a child custody case and that the AI bot only offered mindfulness as the technique, which maybe didn't feel appropriate to the magnitude of the situation. So, yeah, as more people are going to AI for their needs, definitely important to keep in mind some of the implications of that. It might not fully give patients the human connection that they want, and then especially in psychiatry, the relationship between a therapist and a patient's really important for building trust and um, just having a therapeutic encounter can really help patients get better. So we did see in our study that AI wasn't fully able to do that as well as the human.
Do you think that there is, you mentioned that you tested a certain version of ChatGPT. My understanding is the system is constantly refining itself, it's learning. But do you think there's ever going to be a place, a time and place where there's parity, where it will develop the empathy and some of the social interactive skills that a therapist or a medical professional might have? Or is that maybe years or decades off?
Yeah, that's a great question. I think that with each model, it seems to be improving. I think the main thing that I've seen going on in psychiatry is they're building more specific AI bots specific to, for example, giving cognitive behavioral therapy. So those bots might be trained a little bit better on the principles of CBT. Maybe they're getting better at being able to give more personalized treatment. But from our study currently, it seems like it still isn't performing at the level of a human therapist.
And my understanding is psychiatrists, they're medical doctors, so they can prescribe medications. Can an AI bot prescribe Zoloft or Paxil or something for somebody, or is that still like it's just giving advice, not necessarily connected to CVS and Walgreens yet?
No, yeah, it's definitely not connected to CVS and Walgreens. Only a licensed medical provider, like a psychiatrist, can prescribe medication, and especially with some of the controlled substances.
Yeah, I mean I mean it's interesting. It's interesting all these applications across every industry. I think it has its merits, but look, for my money, I'd like to know that that person, if I needed therapy, I'd like to know that that is a real person, and I think it's fine to supplement, but I think it's going to take time to develop. Anisha, great research, great to talk to you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thank you so much for having me. Happy to be here.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And your subscription supports all this great BRN content. We're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.